Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Tyler Jorgensen. He's an emergency medicine and palliative care physician. His KevinMD article is titled Embracing Compassion, a Physician's Journey in Overcoming Prejudice. Tyler, welcome to the show.
Thanks, Kevin. It's great to be here. Thanks so much for having me.
We'll get into the article in a little bit. First off, just briefly share your story and journey to where you are today.
Great, thanks. Well, I've been an emergency medicine doctor for about 13 years. And a couple years ago, I was at a point of burnout, like a lot of us reach at times. And I kind of took some time off and stepped back and re-examined my role in medicine, my career in medicine. And, honestly was at a point where I considered walking away from medicine. But ultimately, that patient care, that patient connection that originally drove me to medicine is not something I wanted to give up. I felt like I was at a point in emergency medicine where I wasn't able to connect with patients like I was kind of had this evolving interest to connect in a new way with patients. And I looked around and found an opportunity to do a palliative medicine fellowship. And I've just finished that up 7 days ago. And I'm now stepping into a role at doing inpatient palliative medicine at Dell Medical School here in Austin, Texas.
All right. That's a wonderful story. And you've had perspectives, of course, from both sides in the emergency department as well as palliative medicine. So tell us how those two fields intersect.
Well, I wish they intersected more. There have been some actual amazing studies, some great work done looking at having a palliative medicine presence in the ER can actually greatly reduce unwanted and ultimately unsuccessful intensive treatments that a lot of patients get. And so where it's possible to have an embedded presence of palliative medicine in the ER, that's great. But beyond that, what I've observed at the med school this year is really there is a huge blossoming of interest among emergency medicine practitioners, among emergency medicine trainees to bring palliative medicine skills to the bedside being used by emergency medicine doctors. And so I think it's a real opportunity for growth, working on communication skills, having better understanding about goals of care and prognostication, and just how to really work with patients to figure out, do they want all of this intervention at end of life, or would they be, would it be better to focus on comfort and focus on presence and being with family and things like that. So there's a great intersectionality of both fields, and I look forward to seeing it continue to grow in the coming years.
Was there any change in the mindset? You were an emergency physician for years, and then you just finished a palliative medicine residency. Tell us about that contrast in those mindsets.
It's funny. One of my inpatient hospice attendings who was training me this year, I would be looking at a patient and I'd have, thoughts, hey, if we put a central line here or did a little mass transfusion, I think every now and then he'd have to be like, stop it, just stop it. That's not, that is not the goal of care here. And so there has been I'd say it's been a gradual shift in my focus. I think all of the emergency medicine experience, I'm very, very grateful for. I think it helps inform my understanding of what's happening with patients and what might happen with intervention and what might happen without, therapeutic or curative interventions. So I'm very thankful for it, but it's definitely a different mindset. And it was a gradual change over the course of the year.
All right, let's talk about the KevinMD article that you wrote. It's titled Embracing Compassion, a Physician's Journey in Overcoming Prejudice. How did your article come together?
Well, first of all, thank you so much for the opportunity to speak about it. I found something new this year in doing palliative medicine that I'd never encountered. And that was the wonder and kind of mystery of home visits.
Hmm.
I found myself on hospice visits and on outpatient palliative visits in patients' homes. And I discovered that you learn more in about 1 minute of stepping into a patient's home or lack thereof than you could in 100 clinic visits. So it was really eye-opening. And I loved being in that setting because that's where patients are most comfortable. And it's also, we are truly coming to them to bring them care. And sometimes we had to escalate care. Most of what we found and most of what I found in patients' homes was charming, endearing, stuff that kind of gave you a warm, fuzzy feelings, quilts, family photos, things of that nature. But what inspired me to write this article is one particular encounter that I had with a patient who lived way out in the country. And we'd been in his kind of shack, for lack of a better term, for a few minutes before I realized that there was a big swastika flag hanging over his bed, like in primacy of place in his room. And there were some old Confederate flags, and we encounter those. Like that's kind of some heritage down here, and that may mean different things to different people. Certainly, it's something that's talked about a lot in the news, but that's
Mhm.
something that we're accustomed to encountering. But finding ourselves in this kind of tight space with honestly a new, freshly purchased, it looked like Nazi flag was just kind of gave me this rotten feeling in my gut. And it was kind of processing that experience and figuring out how to continue to provide compassionate care for this patient that led me to write that article.
So when you saw that swastika at that moment, what was going through your mind?
It was the kind of thing where this patient was very ill, and I was honestly initially kind of transfixed on him and his condition and thinking about what do we need to do for this patient? And if this was my ER patient, what would I do versus if this is my hospice or palliative patient, what would I do? And so it was sort of as I was almost in reverie or pondering that, like what's the best next step, that my eyes kind of drifted up and I saw this thing, and it snapped me out of, you know, and initially it snapped me out of all thoughts of really this patient. And it was just this sickening thing.
Mm.
There's no misinterpretation of a Nazi flag like that. And you don't want to presume, I guess, you don't want to bring in your own prejudices, but this is a symbol of hate. This is a symbol of eradication of segments of the population. This is a symbol of white supremacy. And I think what went through my mind was, geez, this really is a real problem in our society today. It really, it's out there, and it's very, very troubling.
Now, did you have to take a step back, take a moment just to assess and analyze your own thoughts about the situation?
I was able to kind of without physically removing myself in that situation, because it was a very slow paced encounter. It was one that, it wasn't super conversational. We were allowing the moment to kind of breathe. And so I was able to do it within that context. I think if it had been mid conversation or, mid intervention at that time, I think that I might have had to really kind of pause the scene and regroup a little bit.
Now, how were you able to manage those conflicting feelings?
As I wrote in the story, society is complex,
Mm.
and our role can change from time to time. Like my job as that man's physician is to provide him the best clinical care that I can. End of story. End of story. My role as a physician in society, trying to combat ills or educating tomorrow's leaders in medicine, that could look different. We're working, at the med school to route out systemic problems that make healthcare unequitable. We're always combating in this country racism and hate and all these sorts of legacies that we have. So I think, I don't know if this is the right answer, but it's almost like you can put it in boxes in a way. Like my
Okay.
job right now is to care for this patient, and that is all, and to provide compassionate care. And one thing that I find is my starting point is that I try to think of myself as no better than anybody else. I don't know how he arrived at this point. Like to think that, you know, there's good in, like there's good inside this guy. He's got probably some really mixed ideology, some really bad stuff, but my job is to try to see the human inside of him, to care for that human. And it may be my job later in the day to speak out against racism in another way, if that makes sense.
So, what happened next in the story? Did you discuss the case with some of your colleagues?
I did. So I discussed it absolutely with some of my colleagues. It was one where I kind of felt like I had to. And it was really, it was interesting. I was able to share the story with some colleagues locally as well. And they, most people kind of agreed that their starting point was like, you're right. None of us is perfect. We need to show compassion. And then I actually had some colleagues who said, where's the limit? And maybe that's the interesting question, is like, where is the limit? Is there a line a patient can cross where you no longer show them compassion? And I think that's, a very interesting philosophical question, maybe moral question, spiritual question. But I think the story just raised, and most people had had a similar encounter. A lot of people in training, they suddenly realize they're taking care of the person who tried to murder the other patient they're, trying to resuscitate in the ER. And so humans are messy, humans are complicated, and that's our job, is to take care of messy humans. And so it's inevitable that you encounter things like this that challenge you. But it was very helpful to share the story with people.
As you mentioned, especially with physicians in training, they are going to encounter situations like this, especially we live in such a polarized society. After reflecting on your story, what kind of advice can you give to these younger physicians?
I think that one piece of advice would be to talk about it.
Hmm.
You know, what, so after the moment, to really talk about it, to really decompress about it. I think that our trainees today are coming up in a medical culture that is more, I was trained to see the humanity in our patients. I think today's providers are trained to do that, but also to recognize their own humanity. And I'm thankful for that. I'm thankful that we've progressed. And so I would say you first need to acknowledge and give voice to, either through journaling, but I think sharing with somebody else as well, like what that did to you, how that felt. And if it's real immediate, then you need to do that then. You need to do a little mini debrief then, and kind of then put it away and be able to move on and take care of other people, but not to bury it, to do whatever you need to do to be able to continue to care for the people who are your charge. And then I think that in the moment, I think we just have to always be very careful to check our own biases
Mm.
at the door. We walk in to see that patient. We are a minor character in their lives. We are intersecting them at this moment in time. They've had a life to live to get to this moment. And we don't know what led them to be how they are. We don't know, exactly what led them to act the way they do. And so I think just whatever your own personal kind of deep well of compassion is, to always be tapping back into that and always be recentering on that, I think allows you to remain compassionate when you encounter the unexpected and something that you might find dreadful.
We're talking to Tyler Jorgensen. He's an emergency medicine and palliative care physician. His KevinMD article is titled Embracing Compassion, A Physician's Journey in Overcoming Prejudice. Tyler, tell us some of your take home messages that you want to leave with the KevinMD audience.
Well, a couple things. One, I think it's really important to remember that that patient in front of you is a human being who has lived a life that brought them up to this point. I tell all my learners to find the human inside of each patient. And it's a pretty simple concept, but try not to think of them just as a patient. The other thing is, do your best to check your own biases at the door when you're caring for a patient in front of you. You may disagree with them, they may disagree with you and even stand against you in some way. And yet our calling is to do our best to provide compassionate care. But I think my third thing would be to absolutely talk about this. And if you as a provider are in a situation where you are uncomfortable and feel unsafe, that you absolutely have a right to step out and make sure that the situation is safe, and also to just talk about these experiences with others, because it's really important that we don't bottle them up and pretend they didn't happen.
Tyler, thank you so much for sharing your story time and insight. Thanks again for being on the show.
Thank you so much, Kevin. It's a pleasure.